The dawn breaks, a time for renewal, for the gentle unfurling of a new day. Yet, for too many older adults, the morning can arrive not with a whisper of hope, but with a jarring, unsettling signal, a subtle shift in the body's rhythm that whispers of something deeply wrong. It's a critical moment, this transition from sleep to wakefulness, a time when the body, perhaps less burdened by the distractions of the day, might offer its most crucial, albeit quiet, warnings. We are conditioned to dismiss the aches and pains of aging, to attribute every new discomfort to the inevitable march of time. But what if that morning stiffness isn't just arthritis? What if that persistent cough isn't merely the remnants of an old cold? What if the fatigue that blankets you before you've even left the bed is more than just a poor night's sleep? These aren't questions to be pondered idly. They are urgent calls to attention, potential indicators that that silent, insidious enemy, cancer, might be taking root. Ignoring these signals is not resilience. It is a perilous gamble with one's health and future. We'll begin with lung cancer. Consider the persistent cough, a hacking, dry or phlegm-producing cough that greets you before your first cup of coffee. It's easy to brush off, especially for former smokers or those prone to allergies. Just a smoker's cough, you might rationalize, or the pollen count must be high. But when this cough lingers, day after day, week after week, and is particularly noticeable in the quiet of the morning, it demands scrutiny. Lung cancer, tragically common in older populations, often announces itself with such a symptom. The tumor, growing within the airways, irritates the lining, triggering this persistent reflex. The tumor's presence can also lead to increased mucus production, resulting in a cough that brings up phlegm, sometimes tinged with blood. Don't wait. Don't hope it will disappear on its own. Every morning it persists is a morning lost in the fight against a potentially aggressive disease. The quiet of the morning can amplify the sound of this cough, making it more noticeable, a constant, nagging reminder that something is fundamentally wrong. Pay attention to its character. Is it getting worse? Is it accompanied by any other symptoms? The answers to these questions are vital clues that your doctor needs to hear. Then there's the breathlessness that wasn't there before, a feeling of not being able to catch your breath, particularly upon waking or with minimal exertion in the morning. This can be a terrifying sensation, and while it can be linked to heart conditions or other respiratory issues like COPD, it can also be a sign of lung cancer or even cancers that have spread to the lungs. Tumors can obstruct airways, or fluid can build up around the lungs, both of which impede the body's ability to take in vital oxygen. Waking up gasping for air, or finding that simple tasks like getting dressed leave you winded, is not a normal part of aging. It's a red flag, stark and undeniable. The morning, as the body begins to move after a period of rest, can be when this breathlessness is most acutely felt, highlighting the diminished respiratory capacity. Don't try to tough it out or attribute it to being out of shape. This is a symptom that requires urgent investigation to determine its cause and initiate appropriate treatment if necessary. But lung cancer signs are not the only morning warnings that seniors should be watching out for. Pay close attention to changes in bowel habits that manifest in the morning. A sudden, unexplained shift towards constipation or diarrhea, or an alternating pattern between the two, particularly if accompanied by blood in the stool, is a deeply concerning sign. Colorectal cancer, another prevalent cancer in older adults, can alter the function of the intestines. Tumors can narrow the passage, leading to difficulty passing stool, or they can irritate the lining, causing diarrhea. The presence of blood, which may appear bright red or dark and tarry, indicates bleeding within the digestive tract. While other conditions like hemorrhoids or diverticulitis can cause these symptoms, ignoring them when they appear consistently in the morning, perhaps as the body's systems begin to activate for the day, is a dangerous gamble. These changes in bowel habits may be more noticeable in the morning as the digestive system begins its daily activity. Don't delay in discussing such intimate but critical details with a healthcare professional. The earlier colorectal cancer is detected, the more treatable it is. Unexplained weight loss. A phenomenon that might initially seem like a welcome development is in fact a significant warning sign, especially when it occurs without any changes in diet or exercise. Waking up to find your clothes fitting more loosely, or noticing a gauntness in your face in the morning mirror, can be a subtle but powerful indicator that something is consuming your body's resources. Many cancers, as they grow and spread, release substances that alter metabolism and cause a loss of appetite and muscle mass. This wasting, known as cachexia, can be particularly noticeable after the body has been at rest overnight. Don't celebrate this weight loss, investigate it with urgency. It's not just about losing a few pounds. It's about understanding why you are losing weight without trying. This symptom, when it appears in the morning and persists, is a strong indicator that something is consuming your body's resources in an unhealthy way. Fatigue. A profound, persistent tiredness that isn't relieved by rest is another insidious morning symptom that should not be dismissed. We all feel tired sometimes, but this is different. This is a bone-deep exhaustion that makes getting out of bed feel like an insurmountable task. A weariness that lingers throughout the day regardless of how much you sleep. Cancer cells consume a tremendous amount of energy, and the body's immune system, constantly working to fight the disease, also expends significant resources. This can lead to overwhelming fatigue that is often most acutely felt in the morning after the body has attempted to repair and regenerate overnight. If you find yourself consistently waking up feeling utterly drained, despite adequate sleep, if this fatigue is impacting your ability to perform your usual morning activities, it's time to seek medical advice. This isn't just about feeling a bit tired. It's about a pervasive lack of energy that can be a significant indicator of underlying cancer. Changes in the skin, noticed during your morning routine, can also be indicators of underlying malignancy. A new mole that appears, or an existing mole that changes in size, shape, or color, could be a sign of melanoma, a serious form of skin cancer. Pay close attention to moles that have irregular borders, multiple colors, or are larger than a pencil eraser, lesions that don't heal, or patches of skin that become thickened, red, scaly, or itchy could indicate other types of skin cancer. Examining your skin in the mirror each morning, paying attention to any new or changing spots, is a simple but potentially life-saving habit. Don't assume a new blemish is just a sign of aging or a minor irritation. Get it checked by a dermatologist, especially if it persists or changes over time. Early detection is key in treating skin cancer effectively. Persistent pain, localized or generalized, that is particularly bothersome in the morning, can be a sign that a tumor is pressing on nerves or tissues. Bone cancers, for example, can cause pain that is often worse at night and in the morning, possibly due to the body's position during sleep or changes in blood flow. Pancreatic cancer can cause abdominal or back pain that may be more pronounced upon waking. While morning stiffness and aches are common with conditions like arthritis, pain that is new, worsening, or doesn't fit a typical pattern for known conditions, or is not relieved by rest or over-the-counter pain relievers, warrants investigation. Don't simply reach for another pain reliever, seek to understand the root cause. Pain is the body's way of signaling that something is wrong, and persistent morning pain can be a critical warning sign of a deeper issue. Swelling or lumps that you notice upon waking can also be significant. A lump in the breast, testicle, neck, armpit, or groin, or unexplained swelling in the abdomen or limbs, could indicate the presence of a tumor or enlarged lymph nodes. These may be more apparent in the morning after the body has been in a resting horizontal position, which can affect fluid distribution. While not all lumps are cancerous, any new, unexplained swelling or mass should be evaluated by a doctor without delay. Early detection is paramount, and noticing these changes during your morning routine provides a critical opportunity for prompt medical assessment. Don't wait to see if it goes away on its own. Get it checked. Difficulty swallowing, a sensation of food getting stuck in your throat, or pain or discomfort when swallowing, can be a warning sign of esophageal or throat cancer. This symptom may be more pronounced with the first few attempts to eat or drink in the morning. Ignoring this difficulty, or attributing it to simply eating too fast, can have severe consequences. These cancers can be aggressive, and early detection significantly improves treatment outcomes. If you find yourself consistently struggling to swallow in the morning, or if it is accompanied by other symptoms like unexplained weight loss or a persistent sore throat, seek medical attention immediately. Changes in urination, such as a weak stream, difficulty starting or stopping, the need to urinate more frequently, especially at night, or the presence of blood in the urine, can be morning indicators of prostate or bladder cancer. These symptoms may be more noticeable with the first urination of the day, While these can also be caused by non-cancerous conditions common in older men, such as an enlarged prostate, it is crucial to rule out malignancy. The presence of blood in the urine, even if it's only occasional or a faint pink color, is a particularly alarming symptom that requires immediate investigation. Don't dismiss these changes as just part of getting older. They require medical evaluation to determine the cause. Unexplained bleeding or bruising that you notice upon waking can be a sign of certain types of cancer, such as leukemia or lymphoma, which affect the blood and bone marrow. Easy bruising, nosebleeds that are difficult to stop, bleeding from the gums, or prolonged bleeding from minor cuts, especially if these occur without apparent cause and are noticed in the morning, should prompt a visit to the doctor. These symptoms can indicate a problem with the body's ability to produce platelets or other clotting factors, which can be a consequence of these types of cancers. Don't ignore unexplained bleeding or bruising. It is a signal that your body's normal processes are disrupted. Other less common but still important morning warning signs of cancer can include persistent headaches that are worse in the morning and improve throughout the day, which could potentially be related to brain tumors. Changes in vision, such as blurred or double vision, also more noticeable upon waking, could also be linked to brain tumors. Persistent mouth sores or white or red patches in the mouth or on the tongue that don't heal can be a sign of oral cancer, often noticed during morning teeth brushing or inspection. Unexplained fevers or night sweats, while not strictly morning symptoms, can leave you feeling unwell and noticing other symptoms more acutely upon waking. These can be associated with certain cancers like lymphoma or leukemia. It is absolutely vital to understand that none of these symptoms in isolation definitively mean cancer. Many benign conditions can cause similar signs and symptoms. However, the critical point is to recognize changes in your body, particularly those that are new, persistent, worsening, or unexplained, and especially when they present themselves consistently or are most noticeable in the quiet vulnerability of the morning. The urgency in addressing these signs stems from the undeniable fact that cancer, when detected in its early stages, is often significantly more treatable, and the chances of a full recovery are much higher. Waiting, hoping that the symptom will simply disappear on its own, is a dangerous and potentially life-threatening strategy. Time is of the essence when it comes to cancer. The narrative of aging is often presented as a gentle decline, a gradual slowing down. But within this narrative, we must be vigilant for the chapters that speak of something more sinister. The morning, that quiet beginning to the day, can be a time of profound revelation if we are willing to listen to our bodies. Don't let fear prevent you from seeking help. Don't let the normalization of age complaints blind you to the urgent messages your body might be sending. Share all of your concerns, no matter how small they may seem to you, with your healthcare provider as well. Watch the next video for more senior health and wellness information to ensure more golden years ahead.